Hello, and thank you for joining us today. And welcome to the Ecolab webinar on preparing for the 2020-2021 flu season, protecting yourself, others, and your operations this flu season. We know that many types of facilities in different parts of the country are operating at different capacities and in different ways. In whatever way you're serving others or operating your business, we're here today to discuss the upcoming flu season, some special considerations for you and your business, and best practices to help you prevent the spread of infection, to deliver clean, healthy environments for your employees, customers, guests, students, residents, or whomever you're serving. So just a couple of quick housekeeping reminders before we get started. As Earl said, at the end of the session, we'll open it up for questions. So please submit your questions at any time during the webinar using the Q&A feature. Our presentation and a recording of the session will both be available on ecolab.com within a few days. A link will also be sent out to attendees once these recordings are available. And a version with Spanish subtitles will be available in about a week and also posted on ecolab.com. For those of you pursuing education credit, at the end of the presentation, there will be a question with an option to request a certificate of attendance. So I now have the pleasure to introduce today's speaker, Dr. Ruth Petran. Dr. Petran is a senior corporate scientist, food safety and public health for Ecolab. In her current role, she provides technical expertise and consultation to internal and external customers on food safety and public health issues by identifying and tracking emerging trends and new control strategies to help protect people and businesses from the risks of pathogens. So I'll hand it over to you now, Dr. Ruth. Thank you.
Thank you, Jen, and I extend my welcome to all of you who have joined today. We really appreciate your interest in this very, very important topic. So the topics I'm going to address today will be somewhat broad because there's several different respiratory illnesses that we're managing through in this season now and into 2021. But what's really key is that I think we can be prepared for these and really implement effective strategies that can help to reduce the risks. So let's jump into these. First of all, just some statistics to kind of keep us grounded related to some of these common respiratory infections that we're facing these days. We've all suffered many times likely from common colds in our lifetime, and it's estimated that on a global basis, billions of colds will occur. That's just a fact of life, it seems. But the deaths from colds are really not many, but we know certainly that serious complications can result in those who might have weakened immune systems. So we don't worry too much about the cold, but it certainly is an annoyance we need to manage through. But the influenza is a key risk that we need to be aware of. Each year, it's estimated around the world there might be 5 million illnesses, although each season varies a little bit. And flu can cause death. Each year, again, on an estimate basis, about 500,000 may be attributed to the flu. And then, of course, this year, we're in the middle of our COVID-19 pandemic, which certainly none of us anticipated, but it is a reality. So far, there's been more than 50 million estimated illnesses. Actually, I saw last night it may be north of 51 million. The numbers keep increasing. And to date, we've had more than 1.2 million deaths. I do expect these numbers will rise over the coming weeks. But let's ground ourselves a little bit in what we're talking about here. First of all, colds and the flu. Both obviously are respiratory illnesses, but they're caused by different viruses. And sometimes it can be challenging to distinguish these two different illnesses. We know that flu typically is much worse than the common cold, and we suffer from things like a fever, body aches, maybe a dry cough, and just feeling very, very tired. When we have colds, we're more likely to have a runny, stuffy nose and may certainly feel fatigued, but it generally is not to the extent that we would experience with the flu. We know that flu can be transmitted from one person to another through a variety of ways. And we need to keep in mind that this is going to be through droplets that come from an infected person. And this can be direct by touching that person and then touching our eyes, nose, or mouth, for example, or indirectly by touching a surface, an object that may be contaminated with those droplets from an infected person. And it can certainly happen through the air as well, over a distance of a few feet, and those droplets generated by sneezing, coughing, talking, etc. And with the flu, we know that people are most infectious during the first 3 days of their illness. And COVID-19 certainly is presenting additional and very serious threats this season. And like the colds and flu, it is also spread by respiratory droplets from this person who's sick to others through many of the same routes, a direct droplets from a cough, sneeze, or even talking, close contact, such as touching or shaking hands, or this route through objects that might have virus particles on them and then touching our eyes, nose, or mouth. The virus, like that causes the flu, needs to enter through our eyes, nose, and mouth and progress into our lungs, where we see the impacts of COVID-19 affecting us. And certainly we know that transmission from person to person is occurring with COVID-19. So the key really is to develop the right kinds of strategies to manage these risks. And we are faced with a challenge this year of how best to manage those risks for this new illness agent that is COVID-19 that frankly we're still learning about, in addition to the realities of the colds and flu, which will be upon us. So when I think about this, the approach of just relying on just classic risk assessment principles and protocols really makes a lot of sense. And this means that we do as much as we can to identify and understand the risks, continuing to keep ourselves well informed about new research and findings and so on. And with that in mind, we can move to the strategies for risk management, which is what we all need to be adopting. But we are faced with just this dilemma of trying to distinguish between common cold, flu, and COVID. And we've talked about, the fact that generally transmission occurs very similarly through all of them. And this graphic attempts to get to some of these symptoms. But as you'll notice, there really is a lot of commonality between the three. This graphic will be available to you in our flu prevention page that I'll show you a link to at the end, as well as in the email that you will receive after this webinar. So this may be helpful in trying to distinguish what's going on, because that does direct the correct risk management practices as well. Regardless, though, just some kind of top line differences is, distinguishing COVID-19, for example, is typically it spreads a lot more easily than the common cold and flu, at least from what we've seen so far. And in many cases, it is a more serious kinds of illness. Often the symptoms of COVID-19 take longer to appear than those from the flu, for example. And we know that people can continue to be contagious for longer times with COVID-19. But with all of this, and I will repeat this a few times, really it's important to reach out to medical professionals if there are questions about, which of these illnesses is it, and to get specific medical advice on how to respond. But regardless of which illness we're talking about, I do think this approach of these risk management strategies that we basically layer on top of each other can really be helpful. And the idea is that the more of these that we, in essence, stack up on top of each other, the better protected we may be, and the more we can help to prevent the spread of these infections. So these are based on guidance from places like the U.S. Centers for Disease Control and the World Health Organization, and we do update these as we learn new things. But a lot of this has been pretty remarkably consistent since really day one of the COVID-19 pandemic and really in a lot of our previous influenza guidance as well. But this is things that we're very familiar with, like wearing a mask, staying home when we're sick, keeping ourselves isolated, avoiding close contact, certainly with people who are sick, but increasingly we're hearing about just keeping our distance because of the potential of someone to be contagious. Washing our hands, covering our mouth and nose when we sneeze or cough, and then using the right cleaners and disinfection protocols. There are some additional things we can do for flu prevention, and that's getting the annual flu vaccine, which we'll talk about a little bit more here. And then for COVID-19, there are increasing recommendations on the value of increasing indoor ventilation, through turning up the speed of fans and maybe including filters and so on. And then certainly practicing social distancing gets talked a lot for COVID-19 management. But this year's flu season, I get this question a lot, and I wish I had a crystal ball or could, wave a wand or whatever and kind of know how to answer this. But, the best response is, well, we're not sure, and really we just need to kind of wait and see. Although early indicators, and these are really early, is that the flu season, at least in the Northern Hemisphere, seems to be getting off to a pretty slow start. But we've seen this in other flu seasons, so this is not necessarily a marker of things to come, but at least very early on, that's what we're seeing. We do know, though, from the Southern Hemisphere, where their flu season essentially happened in our summertime months, the flu was much milder, and they had a much lower incident rate than they would see typically. There's some speculation as to what could have contributed to those lower rates in the Southern Hemisphere, and they're shown on this slide, but one of them is that, frankly, there might have been just less testing. So they might not have been able to detect the flu that was there because there was so much focus on COVID-19. Certainly that is the case here, but, time will tell. I mean, the other reality, too, is that these COVID risk management strategies, the hand washing and the mask wearing and keeping distance and so on, have, like I mentioned, been talked about for a while. So I do think there may be some contribution of these to lowering rates of the flu because so many of those line up with what we would do to manage the flu. It also could be the effectiveness of the vaccine. The people in the Southern Hemisphere were vaccinated months ago, and that may have played a role. So it's hard to tell, but I'm hopeful that we will see similar sorts of situations up in this part of the world. And that flu vaccine is a really key part of the overall flu response for many, many reasons. Certainly we know that it protects ourselves, but can also protect the people around us because it may lower the likelihood that we get the flu and would transmit it to them. We also have some research demonstrating that getting the flu vaccine can reduce the severity of influenza if you happen to get sick. The good news from this is certainly fewer symptoms and you're not feeling as bad. But another reality on top of this is if there's fewer flu patients, it will be easier to diagnose COVID-19, which we know is certainly circulating. And it will keep our healthcare systems and facilities and so on available for COVID-19 patients. And we're increasingly seeing that hospitalization rates are increasing for COVID-19. So we want to keep those hospital beds, for example, available for the people who really need it. And it's estimated that around 50% of people age 6 months of age and greater typically get the vaccine. At least that's what we've seen from, say, last year's season. But we have seen that vaccine coverage has increased for both children and adults over the past flu seasons, not by dramatic increases, but it continues to trend up a little bit. And I hope we'll continue to see that. I also am asked about, what's the flu vaccine uptake rate so far? And like everything else, it's a little too early to tell, but I did talk to an infectious disease doctor recently in the Chicago area, and his take was that the vaccination rates may be a little bit lower for some reason. But again, that was a couple weeks ago, and you know, really too early to tell. But I think as a matter of history, in 2009, as you recall, we had the H1N1, another flu pandemic going on. We did see higher rates following that and in that season. So regardless, flu vaccines are important, and I urge you, if under the advice of your medical professionals, to really get your flu vaccines. But in addition to that, it's really important that we think about hygiene protocols and do what we can to enhance them, especially in this season of so many circulating respiratory viruses. And the public health recommendations that we all see really focus on fairly standard infection control practices, training, and then certainly complying with those practices. The good news is that many of these are things we've heard about for years, so it's a matter of just doing them, you know, including washing our hands, minimizing our contact with people who are sick, making sure we're using the right personal protective equipment where indicated and where it's appropriate, and then coupling that with environmental hygiene. That's cleaning and disinfection of surfaces and high-touch objects, using the right kinds of procedures, products, et cetera, and of course, following the labels that are indicated on those products. I can't emphasize enough the importance of hand hygiene, and this is an area of great research here as well. SARS-CoV-2 is the virus that causes COVID-19, and a recent study demonstrated that on a human skin model in a lab, they were able to demonstrate that that virus survived longer on human skin than the flu virus. So again, emphasis on hand hygiene to make sure that we're not having remaining viruses on our hands. Unfortunately, the reality is that virtually all of us do not wash our hands sufficiently. And we'll talk through what the procedure is, but we need to keep that in mind, and we all need to do better. We know that there is a risk of transmission via hands of all of these viruses, and hand hygiene is just so important to prevent this spread. So what does this look like? There should be nothing new here, but given that most of us, or all of us, really don't wash our hands properly, I think it's important to review this and make sure that we commit this to our behaviors. We need to wet our hands first, apply soap, make sure we lather our hands well, covering all surfaces, the fronts, the backs, between our fingers, etc. And then where we all fall short is in this 20-second time period of scrubbing. It doesn't sound like much, but when you're standing at a sink, probably eager to go do something else, 20 seconds feels like an eternity. But people, frankly, just do not stand there for that amount of time. If we did, that would really improve our hand hygiene rates. Then we need to rinse our hands after that 20-second scrub, and then dry our hands using a clean towel or an air dryer. And if you can, use a towel to turn off that sink tap to help prevent any cross-contamination. And we do know that if soap and water are not available, use of an alcohol-based hand sanitizer with at least 60% alcohol is sufficient. But again, rubbing our hands and applying that hand sanitizer all over the surfaces of our hands is really important. But we know that cleaning and sanitizing and disinfecting of surfaces can really play a role as well in helping to lessen the overall risk. But these are three distinct actions that need to be done, and I think it's important that we remember these distinctions, because they're all important and they all play roles, but they play different roles. Cleaning is what needs to be done preceding any step of sanitizing or disinfecting. And it's really the step to remove soil from a surface, but it's not going to kill any organisms. But it's important to get the soil off so that the sanitizing or disinfecting chemical that follows can get to those organisms. After cleaning, if you use a sanitizer, that will reduce the number of bacteria in the environment to a significant degree. But if we're concerned about threats from certain more resistant kinds of bacteria and viruses, certainly it's a disinfectant that we need to use because that will destroy or irreversibly inactivate these kinds of agents. So the basic process for disinfecting of non-food contact surfaces is, as I stated, to clean first to make sure that, again, the chemical that follows can reach the contaminants that might be there. Then apply a disinfectant that is registered for use against the virus of concern. In this example, we talk about SARS-CoV-2, that's the virus that causes COVID-19, but really referring to those product label directions is important. And I will mention that Ecolab has products that are one-step cleaner and disinfectants, combining these to make things a little bit more easy to implement. What's really key is step 3, and that's the waiting time. Again, it's hard to wait, but it's very, very important that we leave this disinfectant product on the surface for the time indicated on the directions for use on the label in order to achieve the level of inactivation that we're looking for. And if we shortcut that, the risk is we may not achieve that. Once that time has been passed, though, you can either allow the surface to just air dry, or you can wipe it down. And we get asked a lot about, well, what's the right frequency for cleaning and disinfecting? And, you know, it's hard to say because there's so many factors that affect this. And I think, though, considering what these factors are for your particular operation will help you determine what this right frequency is. And it's things like considering, well, what is the overall infection risk? You know, what are the illness rates within your community, within the facility that we're talking about? You know, if it's a healthcare facility, that may be different than, you know, something outside of healthcare. You know, what is the traffic in and out of your facility? If it's a very, very busy place, that might prompt you to do a little bit more frequent cleaning and disinfection. And then, you know, how much soil is there on the surfaces is, you know, just what builds up there and how often would that need to be cleaned. And the graphic on the right part of the slide indicates that as these factors may increase, you may want to increase the overall frequency of this cleaning and disinfection. But you certainly also need to consider what kinds of products you have available, what sorts of soil and surfaces you have as well. And you may need to reevaluate this as these variables change. And I think especially in light of what's going on with COVID today, it's very important to keep that in mind and to be ready to pivot where you need to. Now I'm going to go through a series of slides that just kind of put this into practice. And as we think about the different kinds of areas within your facilities that you may need to apply these cleaning and disinfection practices, you know, starting off with a room, whether it's a room in a long-term care facility or a hotel, lodging situation, et cetera, really these are the important things to keep in mind. And certainly what you'd want to do to prevent cross-contamination is change gloves frequently, you know, especially after moving from cleaning the bathroom to cleaning other parts of the room or moving between rooms, for example. What we've highlighted in green are some of those specific high touch points where you would want to direct cleaning and disinfection. Again, pretty obvious things that people are touching. So, you know, handles of things and light switches, like the nightstands, telephones, the remote control, you know, things in the bathroom, the faucets, the sink, toilet, et cetera. I think you obviously get the gist here, but the key is to really think hard about what those likely surfaces may be. We can also apply this in more public areas, you know, the entrance to facilities, maybe in the lobby. or in hallways. And the graphic here shows a typical lobby of perhaps a hotel. Again, many of the same kinds of touch points, but some others that we may need to think about, like buttons in an elevator, a luggage cart. Maybe if you have your drinking fountains still in operation, the push plate that someone would touch. You know, the stands where the bellhops are, any public phones, public computers, perhaps armrests of chairs and tables and the like. Restrooms as well. There's many touch points in them. And, you know, I think it kind of goes without saying, but it's important to keep in mind that the cloths and scrub pads and so on that are used to clean toilets and urinals should obviously not be used on any other surface, but we do need to clean them all. But keeping in mind, again, things like the door handles and the light switches, the toilet flush levers, various faucets and other soap dispensers, paper towel dispensers, you know, the changing stations, trash cans, etc. And then there certainly are public areas, whether it be a classroom or a conference room, an office space. You know, really, since these are variable, we don't have a graphic per se, but I think it's you know, you can figure this out. But, you know, just some guidelines here of picking up debris, emptying trash cans, cleaning the outside of those with a multi-purpose disinfectant, dusting where needed, thinking about hard, non-porous surfaces, focusing again on high-touch surfaces, you know, very similar to what we saw in some of the other areas, making sure that those surfaces stay wet for the time indicated on the label, paying particular attention where possible to electronics, but making sure you're following manufacturers' suggestions around how to clean those, because certainly they can be rather sensitive. Cleaning floors, you know, with just typical floor cleaning types of procedures, and then doing a check for quality of those procedures as well. So I think what's really key here is that we work to restore trust with your customers, your residents, you know, your employees, the people who are in your facilities, to provide them with the level of confidence they will need to continue to be in these environments or to come back and return to those. One thing we know about is just making hygiene visible. That is cleaning in front of people to really overtly demonstrate that you are taking a very proactive and in many cases heightened approach to overall sanitation. You know, focusing on these high touch surfaces, communicating what you're doing through a variety of means, whether it's a posted check sheet of just indicating when, say, the restroom was last cleaned, displaying the kinds of procedures that you're following, again, being very transparent in what you're doing. We know these germs that cause these infections are invisible, and the key is to, you know, manage the reality of those invisible illness agents and move to very visible responses to them through some of these that we've talked about here. Ecolab does have examples of tools like this, and this is just one of many that we can make available as a way that may help your housekeepers and others follow the routine cleaning and disinfections that might need to be done, in this example, in a hotel guest room. For example, you know, as someone might be doing a check on this room afterwards, indicating what was done well and what might need a little bit more attention. Again, just a way to make sure and to help guide, you know, where improvements may be needed. So we're getting to the end here, and I'm happy to take lots and lots of questions that you may have in mind. But I think through all of this, I continue to go back to this slide and impress upon us all that this idea of choosing the right risk management strategy is really important, but as best we can to layer these on top of each other that can really help to minimize risk and help prevent the spread of infection. And again, these center in things we do personally, like wearing a mask, staying home when sick, avoiding close contact with others, washing our hands, covering our mouth and nose, and coupling that with cleaning and disinfection done properly and of the right kinds of surfaces. In addition to that, for flu management, getting our annual flu vaccine, and for COVID-19, increasing ventilation and practicing social distancing per the recommendations from bodies like the CDC and the WHO. I just want to acquaint you with some of the resources that we have available for you. We are building out a page focusing on influenza. The recording of this webinar and the slides will be available at this link in the days to come. And in addition, there are many, many infographics and sheets and so on, cleaning procedures that you can access there. We have had a COVID-19 resource page for many, many months. And at that, we have information related to our readiness kits for helping to manage these risks. We've done a lot of webinars on COVID-19 and the recordings of those would be available. And we have information related to different market segments. Shown on the slide here is one related to education, but we have similar types of materials for the long-term care market, for lodging, and for food service. We have procedures available, various fact sheets, wall charts, reopening procedures, et cetera. So lots and lots of help for you in the time to come. And we would encourage you to check these out. And with that, I really thank you for listening to me.
Great. Well, thank you everyone for joining us today. We appreciate your attendance. As we've said before, this recording will be available on ecolab.com along with some more resources around flu prevention this year. And want to thank you again, Dr. Ruth, for sharing all this great information. Have a great day, everyone.